Whereas emergency medical services is a vital public service, and whereas the members of emergency medical services teams are ready to provide life-saving care to those in need 24 hours a day, 7 days a week. And whereas access to quality emergency care dramatically improves the survival and recovery rate of those who experience sudden illness or injury. And whereas the emergency medical services system consists of emergency physicians, emergency nurses, emergency medical technicians, paramedics, firefighters, educators, administrators, and others. And whereas the members of emergency medical service teams, whether career or volunteer, engage in thousands of hours of specialized training and continuing education to enhance their life-saving skills. And whereas the theme for this year is EMS Dedicated for Life, it is appropriate to recognize the value and accomplishments of emergency medical services providers. Now therefore we, the Commissioners of Lebanon County, do hereby proclaim the week of May 18th to the 24th, 2014 as Emergency Medical Services Week in Lebanon County. And in recognition of this event, we encourage the community to observe this week with appropriate programs, ceremonies, and activities.
Okay, there was a reading of a proclamation. Is there a motion?
I'll make a motion to adopt the proclamation.
I'll second the motion.
All those in favor say aye.
Aye.
Aye. Opposed, same sign. Motion carries. Do you mind just introducing everyone so that she
Certainly.
knows who's here?
I'm Ralph Backenstoes. I'm the president of the Lebanon County Ambulance Association. To my left is Brian Smith, the Chief Executive Officer of First Aid Safety Patrol and also our Vice President. Directly behind me is Jim Rittle, who is the Treasurer of the Ambulance Association and also a member of Myerstown First Aid Unit. This gentleman back here, I don't know if you need me to introduce John or not. He tries to hide. And Barbara Chambers is our secretary. And Brian, I'll let you introduce this gentleman.
And then Alexander Kuhn is from the American Heart Association, and then Aaron is our local American Heart Association rep.
And do you have anything you'd like to say?
Indeed I do. First, I'd like to thank Jamie and the commissioners. Given that you have time constraints and you have pressing issues, I want to thank you for taking time to honor the brave and dedicated men and women who provide care and stand watch over our communities and stand ready a phone call away to render life-saving care. Our event through the week, and I offer to the commissioners, if you would like to come out and rub elbows with us on Tuesday at the Good Samaritan Hospital in the parking lot, Brian and I are going to cook, don't laugh, Bubba burgers for our EMS cohorts and the ER staff. And on Friday at the mall, we have our annual EMS Week event. And our EMS Week event is primarily broken into 4 categories. The first category is, number 1, encourage individuals to enroll in pre-hospital courses that will allow them to render care to the community. Number 2, to thank those that have stood watch over our communities. We have, from our partner, the Good Samaritan Health System, collector pins and t-shirts that we're going to give them. Number 3, if folks are looking for some place to volunteer, if they're looking for workplace information, we'll have the managers and CEOs, so to speak, of the companies there that they can speak with them about volunteer opportunities and employment. And last but not least, we invite the community to come out. We will have a special stand. We will help you learn how to do hands-only CPR. We will show young people how to dial 911. We will have a 911 simulator. They will actually be able to dial 911 all the way through, just as though they were calling one of John's dispatchers, and we will work them through that, so if they ever have to do it, it's not a frightening experience. We also will have tours of our ambulances, the Lifeline aircraft, and a little bit of an opportunity for the public to rub shoulders with those that come out. We're going to have this year a little something different. We're going to have a kids table, and the kids table is something to break the ice in the event that they would ever need to be interactive with an EMS service. We're going to have a stethoscope that will let them put in their ears and listen to their heart rate, listen to our provider's heart rate. We'll have a pulse oximeter there for them. We'll have a pen light. They can shine the light in our proctor's eyes and in their eyes, just to try to break the ice so that if ever the ambulance comes screaming up to their house for them, it takes away a little bit of the anxiety. And we also just want to mention that we feel very fortunate here in Lebanon County. Our providers, our agencies are recognized for their outstanding quality of service, not only locally, but at the state level, but you're going to find out this afternoon nationally. And this is not just like one small group that's recognized. This is a large group of people throughout our county that give their time, that they make sure that we have the life-saving and life-sustaining care that we need in a time of emergency.
The lead into why Alex is here. For the last handful of years, we've had the opportunity to have this presentation, the proclamation, and every year we kind of say, hey, is there something you want to talk about? And I always like to talk about our organization. I have a lot of pride and passion in First Aid and Safety Patrol. But for a long time, I was talking about the cardiac monitor programs and the work that we're doing cohesively with the Good Samaritan Health System and the programs that we're putting into place. And recently, the American Heart Association has provided an opportunity for some recognition in actually meeting some standards, some data standards, and where we need to be recognized. So I'll let Alex go ahead with his presentation.
Absolutely, and thank you, Chief. And once again, I'm very excited to be here in Lebanon, Pennsylvania, to celebrate the achievements of First Aid and Safety Patrol on the quality of care provided and the impact it's having in the community it serves on reducing death and disability from the most serious type of heart attack called an ST segment elevation myocardial infarction, or STEMI for short. The American Heart Association recognizes the critical life-saving role EMS providers provide to the overall success of a STEMI systems of care program. The correct tools and training allow EMS providers to rapidly identify the STEMI, promptly notify the destination center, and activate an early response from the waiting hospital personnel. As an EMS agency that delivers education in STEMI identification, provides access to 12-lead ECG machines, and develops protocols derived from the American College of Cardiology and American Heart Association STEMI guideline recommendations, your pre-hospital professionals are driving improvements in STEMI systems of care here in Lebanon. Beyond these basic components of a high-functioning STEMI system of care, First Aid and Safety Patrol is part of an elite group of EMS agencies in the U.S. focused on not just high-functioning systems of care, but also high-quality systems of care. First Aid and Safety Patrol joins 207 other EMS agencies in the United States and is only one of 29 agencies in Pennsylvania that are receiving the inaugural 2014 American Heart Association Mission Lifeline EMS Performance Achievement Award. As one of 19 EMS agencies in Pennsylvania, First Aid and Safety Patrol joins 108 other agencies in the U.S. receiving the Bronze Performance Achievement Award. To achieve the Bronze Achievement Award, First Aid and Safety Patrol achieved at least a 75% or higher compliance score on specific EMS quality measures for at least 3 to 9 months. These measures include the percentage of patients with non-traumatic chest pain over the age of 35 treated and transported by EMS that received a 12-lead ECG. The second measure is percentage of STEMI patients transported to a STEMI receiving center, Good Sam, who with a pre-hospital first ECG to device, time the arteries open, within 90 minutes. People are celebrating life today because of the hard work and dedication of First Aid and Safety Patrol. Your community should be very proud of your pre-hospital professionals. For their accomplishments, the American Heart Association will recognize First Aid and Safety Patrol throughout the year at professional meetings, in our national professional journal circulation, and on the AHA website, as well as many other avenues. So on behalf of all the staff and volunteers of the American Heart Association, I would like to present First Aid and Safety Patrol with the American Heart Association's Mission Lifeline 2014 EMS Bronze Performance Achievement Awards. Congratulations on your accomplishments.